Good evening, my people. It's yet another good evening whereby we will continue with our discussion of one of our most important topics we have ever had. One of the topics that most people had requested about kidney failure, and I hope those who had requested this topic so far so good, you are getting something out of it. Today we will have another subtopic about type 2 diabetes and kidney disease. Type 2 diabetes and kidney disease. And before we continue, if you are there and you are watching this channel for the first time, please take a minute or two or a few seconds to subscribe, like, comment on our videos so that they may reach as many people as possible. And let's make this channel a big success so that it may continue educating us more and more. For the returning subscribers, I always appreciate you people because your efforts have pushed this channel up to where it is at the moment. Feel appreciated. Type 2 diabetes and kidney disease. People with type 2 diabetes develop kidney disease, and this occurs when the kidneys no longer filter blood effectively. Basically, the main function of our kidneys is filtering toxins from the blood. Toxins, for example, urea, creatinine, and all that. So, people with type 2 diabetes develop kidney disease, which occurs when the kidney are no longer able to filter blood effectively. A question to ask, and this is very important: what is diabetic nephropathy? What is diabetic nephropathy? Nephropathy or kidney disease is one of the most serious complications that many people with diabetes may experience. What is diabetic nephropathy? Nephropathy or kidney disease is one of the most serious complications that people with diabetes may experience. So basically we are saying nephropathy is just a complication that occurs to the kidneys when somebody has diabetes. Nephropathy is the leading cause of kidney failure to most people. Nephropathy is the leading cause of kidney failure to most people, especially people with diabetes. Diabetic nephropathy or diabetic kidney disease, into brackets DKD, develop in 30 to 40% of people with diabetes. This is very important, that diabetic nephropathy or diabetic kidney disease, DKD, develop in 30 to 40% of people with diabetes. Diabetic kidney disease can cause end-stage kidney disease. Diabetic nephropathy all diabetic kidney disease develop in 30 to 40% of people with diabetes. Diabetic kidney disease can cause end-stage kidney disease. When we talk of end-stage kidney disease, this is whereby the kidneys can no longer filter anything. They have completely failed. This is completely kidney failure. That's why we are saying diabetic kidney disease can cause end-stage kidney disease, which occurs when the kidneys no longer work effectively enough for day-to-day life. Diabetic kidney disease can cause end-stage kidney disease, which occurs when the kidneys no longer work effectively enough for day-to-day life. In other words, the kidneys have completely failed. This is a very important point, and I want to repeat it, that diabetic kidney disease can cause end-stage kidney disease, which occurs when the kidneys no longer work effectively enough for day-to-day life. People with end-stage kidney disease either use dialysis to manage their kidneys daily functioning, or relieve kidneys, or receive kidney transplant. You see, this is why we are calling it end-stage kidney disease, because the kidneys have failed completely. They have failed completely. That's why we are saying people with end-stage kidney disease either use dialysis, which assists them to filter the blood of the toxins like urea and creatinine, to manage their kidneys or their kidney daily functioning, or receive kidney transplant. This means that people with end-stage kidney disease or who have complete kidney failure, the only two options available are either dialysis for day-to-day life functioning of the kidney, or they receive kidney transplant. How many people can agree to donate you one of their kidneys? So it's important to make sure you take care of your kidneys, because it's not easy for somebody to just decide to donate you one of his or her kidneys. A point to note, as per National Kidney Foundation, as of 2018, majority of Americans had end-stage kidney disease and needed dialysis to live. As per National Kidney Foundation, as of 2018, majority of Americans had end-stage kidney disease and needed dialysis to live. So dialysis was the only option to assist them in filtering the blood to remove the toxins which you have been talking about. For example, urea and creatinine, which are dangerous to the body if they are not filtered or excreted from the body systems. So, as per the National Kidney Foundation, in the year 2018, majority of Americans had end-stage kidney disease and needed dialysis for them to live. Diabetic nephropathy has few early symptoms or warning signs. Remember, this diabetic nephropathy occurs during the last stages of kidney failure, or when the kidneys have failed completely. That's why we are saying diabetic nephropathy has few early symptoms or warning signs. Kidney damage from nephropathy can occur for as long as a decade before symptoms appear. So it might be asymptomatic until it becomes too severe for it to show its first signs and symptoms. So, diabetic nephropathy has few early symptoms or warning signs. Kidney damage from nephropathy can occur for as long as a decade before symptoms appear. This means you can have this for more than 10 years for it to show the first signs. Diabetic nephropathy symptoms are as follows. All symptoms of kidney disease don't appear until the kidney are no longer functioning. Diabetic nephropathy symptoms. Then we say, symptoms of kidney disease don't appear until the kidney are no longer functioning properly and include the following. So symptoms of kidney disease don't appear until the kidneys are no longer functioning properly and include the following. Number one, fluid retention. This appears because the kidneys have been interfered with and their functioning has been compromised, so they won't be able to excrete all the fluids from the systems. That's why you find somebody having swollen legs, ankles, and all that. Swelling of feet, ankles, and legs, we have just talked about. Decreased appetite. Number 4, frequent exhaustion and weakness. Number 5, frequent headaches. Number 6, upset stomach. Number 7, difficulties in concentrating. Number 8, we have insomnia or lack of sleep. Number 8, we have vomiting. And the last one, we have nausea. Symptoms of kidney disease don't appear until the kidneys are no longer functioning properly and include the following. Number 1, fluid retention, which I've just explained. Swelling of feet, ankles, and legs. Decreased appetite or decreased urge to eat or feed. That's why you find some of these people have decreased muscle mass and decrease in weight. They don't gain any weight because the appetite is so down. Next one, we have frequent exhaustion and weakness. We'll find them that they are just weak. They look exhausted and tired. Next one, we have frequent headache. Next, we have upset stomach. We have nausea. We have vomiting. We have insomnia, which is lack of sleep. And then the last one is difficulties in concentrating, because this will automatically affect the brain cells, and this leads to the difficulties in concentrating. This marks the end of our video today. Thank you for those who are following me, because it's not easy for somebody to use his or her own bundles and go through my videos. May God bless you people. And for those who have not subscribed, consider subscribing, because many people are appreciating our online education. Have a lovely day ahead.